Hello, my name is Prabhu Rajendran, Paediatric Consultant.
Hello, my name is Graham Fitzsimmons, Theatre Operational Manager.
Hello, my name is Helen Allman. I'm the Senior Sister on the Paediatric Unit.
Pre-COVID, all paediatric patients were booked onto routine mixed adult and paediatric lists with only one or two dedicated paediatric lists. The constraints of this model were that the number of patients we could operate on depended on the bed availability for elective patients on the paediatric wards.
During COVID-19, planned surgery for paediatrics was cancelled in the third week of March, although some urgent surgery was still carried out following new guidelines.
We, as a service providers, were always responsive to local and national prevalence of COVID-19 by closely monitoring the dynamics of the pandemic.
In May, we set up a working group of key stakeholders and began discussions around resuming paediatric elective surgery.
With a new understanding of the challenges we faced, it was agreed to introduce dedicated paediatric operating days, incorporating our day surgery ward facilities with the full support of the paediatric nursing teams and paediatric specialist clinicians, all in one area.
We identified a system to facilitate local swab testing for staff and patients following the NICE guidelines on swabbing and isolation. The only deviation was that we decided to swab both parents to ensure that at least one parent or carer to come in if the other one had to go to work or was unwell. This enabled more equitable access for all our families.
Oh, that's lovely, thank you very much. That's great. So I'll just jot those down for you. This is what they signed before she has her operation.
Is that okay?
From all the planning, we were able to facilitate putting together new standard operating procedures and pathways for day surgery and create a new leaflet to be given to families at pre-assessment. With these arrangements in place, we resumed our services on the 7th of July and now have regular lists on the 1st and 3rd Tuesday of every month with full lists of approximately 30 to 40 patients.
This enabled us to increase our numbers in a safe and effective manner in a dedicated unit. Following the pathway, rapid discharges were encouraged and also supported.
Are you very cheeky, Sebastian? Aren't you? Are you cheeky? This is just our friends and family survey, Mum. And if you don't mind filling it out for me, it's just about your stay at SSSU.
It's been brilliant. It's all very straightforward. He's come in and he's had his procedure done, and yeah, been very well treated.
The teams made reasonable adjustments to the procedures and processes within our trust so that we could stratify patients according to the Public Health England pathways. One of the challenges faced during this period was getting the swab results back on time. After carrying out a mini root cause analysis, we identified that having the swabs delivered to the lab in staggered batches and with effective two-way communication, this issue was resolved. Along with this, our labs also acquired 2 additional Samba 2 machines. Rapid implementation of these changes brought an improvement in our admission rates. Overall, this workplace inclusion and rapid implementation of improvement supported our successful thriving at work.
Is he a big smile?
Yeah.